Google Rotary E-Club.
Again,
Thank you, Norm. Thank you, Norm.
Well, that's an example of collaboration. September 30th. September 30th. What we want to do is we'd like to have our club collaborate with this, the E-Club people, have various clubs collaborate, for events like August the 24th. We'll talk about that in a minute. But there's big deals of stuff going on, and we can collaborate with other clubs. That'd be good. So with that, let's get into the program. Let me do this. Let's go into the meeting. So let's see. Which other people? Oh, we have more people added?
Yeah, we added.
Oh, here we have to, because the people I can't even see. Who do we have at the end?
There's Joe and
Joe, could you like
Richard.
Yeah, introduce yourself.
and another person.
Introduce yourself, please.
I'm Joe Grady.
Richard Martin. Can't talk very well. Wow, I'm such a fun now at RV. Oh, yeah, what we want to do is collaborate with you.
What's his
Okay,
name?
let's make it to back.
What's his name?
Stop you. Okay, let's move into the, this right here. Let's stay together. Let's stay together. What we're going to do is we'll do a pledge of allegiance. We'll do the prayer. We'll talk a little bit about club activities, introduction to members, and then the main program will be Asencion Seton. Yes.
Your chair people may have something to say. I have something to say about foundation.
Okay, that'd be fine. We'll do that in club activities. Yes, that'd be good. Okay, with that, let's move into
The pledges to the American flag. I
pledge allegiance to the flag
of
the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
The Texas flag.
Honor the Texas flag.
I
I pledge allegiance to thee, Texas, one state under God, one and indivisible.
anyone like to lead us in a short prayer? Anyone?
But I'll thank you.
Yeah.
Lord, we love you, thank you for this day, I think. It's time together to serve our community, fellowship. Be productive. Bless the students. Amen.
Thank you. Okay. We're glad to have some visitors here. One of our emphasis in the program, a focus we have is on programs of local relevance. Today's program is an example of stuff which is we care about that's going to affect our lives, like local government, local organizations, and that kind of stuff. Let's see. So this is Seton Ascension. Let's see. The 10th is going to be Rick Knoll and company. Or the 3rd. I'll read the schedule. There's an error in my thing. Yeah, we'll talk about scholarships. Yes, I'm recording. What we want to do is helping young people is a good thing. So our club ended up with giving 4 scholarships to local students. Five. That's a good thing. And that was by club funds. Well, that's a good thing. And then we arranged for a district scholarship of $5,000. And we're doing additional, which we might call mini scholarship, for someone supporting our event. So that'll be the following thing with Rick, and he's going to have the students here, right, Rick?
Yes, 4 of the 5 will be here.
That's a good thing, because supportive young people is a big deal. We're going to sell them careers. And then let's see, the 24th is going to be kind of a big deal. That's going to be Texas Technical College, where the mayor Bastrop here. We've invited us there. It's going to be Earhart. What we're going to do is then talk about what they're doing at Texas Technical College, and then we'll have our scholarship winner will be here, and another couple students, and talking about the good work they're doing. One of their projects is to, as part of their scholarship thing, is to make bike racks for the city of Bastrop. And then so there's other programs. Now this is a big deal. Is September 3rd and 4th is the Lost Pine Barbecue Showdown. Joni is the leader of that. So this is what we need here. It's a fundraising barbecue competition. We're going to be putting out banners tomorrow at 11:30. We have a get together at City Hall. Anyone's interested in that? But that's going to be Joni, who's available, whatever. So it's going to be a big deal event. Help is needed. Invited donors for this event are invited. You know, for again, it's a fundraising event mainly for local causes and organizations. So that's kind of the business. Now, so Michael, you have something on foundation?
Yes.
Your new foundation there. Has sold his ranch. He's gonna be living part of the year in Bastrop, part of the year in Minnesota. I think that's where he is now, but I'm not sure. He spilled me his hometown. So as your new foundation chair, you'll be getting some emails from me. I'm gonna try using SumRunner. And I'll check with you at meetings to see if you got them. If for some reason your software is sending junk mail, I may create another group that sees my Yahoo email. But we have opportunities to participate, and there's some information I'd like to give you about how foundation works. It's sort of like exponentially, geometrically multiplying a little bit we give as individuals to help issues around the world. So our fund has consistently been every member every year, and every member has consistently provided $100 at least a year. So you'll be getting some information from me about that somehow. Thank you.
Yeah, basically our September 7th program will be by the district leader. So it'd be kind of a Michael, you and him
About what?
on the Rotary Foundation. That's the program.
Okay.
Jerry Chapman will be doing that. And people
Well,
are,
no.
so anyhow, that's kind of the deal with that. All right, so this is a showdown. At this point, we're ready.
No, it's okay. I can eat after.
Okay. Jace, Jace is going to talk about Asencion Seton. For those who have not used Asencion Seton, and like in Janice and my case, we showed up from so new because of a medical issue, we barely found the place. But since we've been there many times and very pleased, if we have a Tractor Supply and we have a Harbor Freight and we have a Lowe's and we have a medical facility, we're done.
My wife says you need a Target before.
I don't need to.
Yeah, but the problem with Amazon is you buy what you intend to buy. Target is you never know what is gonna present itself. So, good afternoon, everybody. My name is Jace Jones. I'm the new Chief Administrative Officer for Asencion Seton Bastrop and Asencion Seton Smithville. So I'd like to start off by telling you a little bit about myself, previous career, how I ended up in Bastrop, and then what are some of the plans we have moving forward. So originally born and raised in Bryan College Station. I'm not an Aggie. I actually attended UT Austin for my, there we go. I knew this was gonna, I just kind of sensed it right there. And I can remember going to football games growing up. My dad loved to come through 21 to 71 because the traffic was less getting to the stadium. He went through Bastrop. And when I came down to interview, I called my wife. I said, whatever you think you remember of Bastrop, you're absolutely wrong. I have a wonderful wife, Julie. She's originally from Huntsville. Now she is an Aggie. Because I'm married an Aggie, I get a discount on my season tickets for our outreach.
I'm going to turn this off.
Sure.
It's superfluous.
Have two young daughters. My eldest Emery is 12. She'll be 13 in August. My youngest is Kinsey. She turned 11 in March. So it's a new role for me having daughters because I'm the eldest of 4 boys. So I'm learning a lot about listening in quite a lot of ways. I'm also finding out I'm wrong more and more every day. But my parents tell me I'll be smart in about another 10 to 20 years. So I'm just biding my time. So I attended A&M for my graduate work. I got my master's in public health, School of Rural Public Health, because at that time, I remember driving through small towns on the way to go hunting or fishing and wondering, well, where do people go when they're sick? What happens if this happens? And had an opportunity to go to Trinity in San Antonio for my master's. But two things happened. One is I discovered it was the School of Rural Public Health. And number two was I met a really cute blonde who was not going to move to San Antonio for a guy she just started dating. So I think I caused quite a bit of trouble within the master's program because I kept asking a lot of questions. Why don't we do this? Well, why don't you do that? And a professor said, well, why don't you just go get your PhD? And I said, absolutely not. My wife's pregnant and I've got to get a job, a job. Those are important. But managed to find a really great professor that was taking over the department at the University of Texas Health Science Center in Fort Worth, who had some research dollars set aside that he could afford to pay me to read about the stuff I wanted to. So I started out my career in Victoria at DTAR Hospital, which is 2 campuses, 300 plus beds, neurosurgery, CV surgery, had a lot of great things going on. Probably the big milestones when I was there was working with Texas A&M for a family medicine residency. That's a need that's been defined for a long time, is physicians trained in more rural areas and keeping them within the rural areas to practice medicine. It doesn't hurt that the chancellor of Texas A&M was from Victoria either, getting A&M to agree to work with us. We went from a 22 to 40 bed ER while I was there. That was a pretty big construction project. Also managed to do a new 30 bed ICU. Spent 5 years there as the assistant CEO and got promoted to Abilene Regional Medical Center, where I was the COO of a 30 bed hospital. We did another ER expansion. We implemented a joint center of excellence. So those who come in and get knee replacements, we can have you up and walking within an hour of the surgery and you go home the next day. Good Lord. It was amazing. Got to do a lot of fun work with Dyess Air Force Base, working with them, the airmen and airwomen there as well. Was promoted to CEO of Brownwood Regional Medical Center. Spent about a year and a half there, but last year the company sold Brownwood and Abilene to another company, and I stayed with the company. They asked me to be a project CEO, which is kind of a troubleshooter. And lo and behold, the first place they sent me was Carlsbad, New Mexico, because that was their first big spike of COVID. The CMO was relatively new. We had 38 nurses out due to COVID. We were boarding patients in the ER that needed to be within the ICU. It was just, if you can think of a perfect storm, we hit it there in Carlsbad. So randomly learned about the Seton position. And my first question to Seton was, are you going to move me every 2 years? And they said, not unless you want to. I'm like, I'll keep talking to you. And so go through the process, and I get here and they said, did anybody tell you you're going to be over at the Bastrop hospital? And I'm like, no. Well, how do you feel? I'm still good. I can. They said, really, what we liked was all your construction and expansion experience at a hospital, and that's what we want to do to Bastrop to meet the needs in the population as everything grows. So came down, believe it or not, we found a house. I know, I'm completely lucky. And it's here in Bastrop. I firmly believe that if you're going to run a hospital in the community, you need to live within the community. I think you can understand the community needs better by living. It's a perfect fit for my wife and I with 2 little girls. Small town enough that, I'm not afraid to have them run around the neighborhood, but on the other hand, we could sure get to a Longhorn football game a lot quicker. Soon to be an SEC game, I understand.
Thanks, guys.
My Aggie buddies are wearing me out with, you know.
Play real football.
Oh. Hey, it worked for you guys in 1939, so maybe it'll work for us. So let me give you a quick rundown about Bastrop within the Seton and how it came to be and where we look to in the future. So there was a concept in healthcare called a micro hospital. And the reason we call them micro hospitals is the insurance companies more and more are preferring that their beneficiaries do not stay in the hospital. In fact, a hospital would prefer that you not be admitted, not a hospital, but an insurance company would prefer that you not be admitted to begin with. They place a premium on us keeping you out of the hospital, which is just fine with us. So the campus here is 35 acres. It's a 9-bed ER, and it's got 6 what we call inpatient beds. And those beds were originally intended to, if you came in with chest pain and you didn't need to be admitted, but we didn't feel safe sending you home, we could keep you overnight. Yeah, I can't violate HIPAA, but.
No, that's my story.
So that's what it was really intent upon doing. The second floor houses our clinic. And then we also have our cardiac rehabilitation program. What Seton figured out was plenty of residents of Bastrop County, if they have a heart attack, they go to one of our bigger hospitals. But the follow-up after your stent or cardiac cath, it's really important that you do the cardiac rehab. So that takes up a majority of our second floor. Now, everything looked good, and then we had something called COVID, yes. And then we also have Tesla now coming. And then I think, yeah, there's a little startup called Amazon, Facebook, Abbott Lab, all that. So I don't think I think they originally started this in 18. I don't think they knew all the growth and development that was happening. When they bought the campus, they assumed we would have growth and development east of Austin. If you just look at the history of Georgetown, Round Rock, but also South Kyle, Buena. I can remember when there was a significant gap between Austin and Dripping Springs on the way out to the Deerly. So I think they assumed it would be kind of like Dripping Springs. Over time, it would grow. And then Tesla hit. So a little bit behind the 8 ball as far as what we need to have here in Bastrop. I think primarily one of the reasons we really haven't started is every time we think we have a plan, somebody else is coming to the Austin metro area and it shoots those plans down, and we have to go back to the drawing board. At our last meeting to meet the demands and population growth in Metro Austin alone, we have had 900 beds. 900. Now, no, ma'am. Well, mostly no, that's just Austin Metro.
Austin Metro.
Now, a hospital can add beds in the rooms easily. There's 2 issues. One is parking. They say for every inpatient bed you build, you need to have 2 parking spaces. And if you've ever been to some of our bigger facilities, we are landlocked. The other thing is staffing. Nurses, respiratory therapists, phlebotomists, some of the radiology techs. You can have all the beds you want, but if you don't have the people to help take care of the people, what's the point in building? So I think moving forward, what we want to do with Bastrop is we want to meet the needs of the population. So the first thing that we know we need to look into is what we call ORs, right? Those who need surgery, especially day surgery, be able to stay here in Bastrop and have it. Now, day surgery is where you go in the morning, you have your gallbladder, your appendix removed, and you go home the same day. And that's in fact what insurance wants us to do. Now there's always those patients who have some underlying health conditions we need to keep you overnight. The other thing that we're looking into is adding more clinic space. Monday, this week, Dr. Elizabeth Paula started to practice with us. She's a new family medicine physician. She's absolutely adorable. She's originally from Kansas, practiced in Raymondville, Texas, of all places, for a little bit, and then I was surprised she got out, but she managed to find some acreage outside of town, so it's a good place for her and her husband and her kids to, you know, raise some chickens and some kids, but also practice medicine. Starting in August, we will have Dr. Cure coming to our Smithville and some of our Bastrop locations. He's another family medicine physician. So as a population grows, we're really trying to meet the primary care needs first. We do have specialist clinic right now that has taken off. So we have Seton Heart Institute is in our building 5 days a week. And to make it more convenient for the community, the normal test, the stress echocardiograms, we can do those all within the walls of our building here in Bastrop. You don't have to go to Austin to have them done. On top of that, we have our cardiac rehab program. Then we also have maternal and fetal medicine from UT, the Dell Seton joint venture we have, coming out 1 day a week. We're looking at bringing OBGYN to the area as well. Just a personal side note, when we were looking at houses, I kid you not, every couple leaving a house that we wanted to look at, she was either with child or had a small baby on her hip. And then when we were leaving the house, we saw the same thing. And I thought to myself, two things. One is, thank God I'm out of that stage. And number two is, where are they getting their OB? Right. And what we're seeing now, most of the increase in the population, at least from our data, is young couples who live in Austin, ready to start raising a family and moving out this way, because believe it or not, the housing is more affordable than Round Rock, Georgetown, and that includes the property tax. So we really need to look at what we call maternal and fetal health. So that's OBGYNs. And then maternal fetal medicine is for high-risk pregnancies. Those patients that it's not expected for them to have an easy pregnancy or delivery, we have them. And when they come out, they bring their ultrasound technician, so we can do those high-risk ultrasounds all within the walls of our community. Now, exciting news, we think we're about to have an orthopedic PA here 5 days a week within the next couple of weeks. Our orthopedist, Dr. Husseini, is normally at our Vernon facility, but he is starting to do cases at Smithville, since that's where we have our O. So some of the small fractures that might come through the ER, the PA can see them, and we can get you to Smithville and perform the operation there. We're also looking at increasing our cardiology presence as well. Probably the most exciting thing we have coming up within the next few months is our telehealth services. So we will have telecardiology and teleneurology starting in August. Now, that's for those patients we're kind of unsure of, and it sure would be nice to have a cardiologist immediately available. We can use the telehealth platform to get a quick consult. Now, if you're having a heart attack, you'll still need to go in to the big gun in town. We don't have a cardiac catheterization lab yet. That's kind of one of the things I want to add first, but all it takes is money. So, but teleneurology, if we catch a stroke in time, we can give you a medication called TPA. In the ER, it breaks up the clot, and then we could keep you overnight, do a follow-up MRI, and send you home. So really trying to meet, if we look at what transfers out the most, that's the easiest to keep, it's mostly cardiology and neurology services. So we want to start there. And when it comes to the actual design and plans, it started off at, well, we'll make it 100 beds. And then it was 150. And then it was 200. And then now it's like, well, let's do 200 beds, and then let's look at building another hospital closer to Tesla along the toll road. I'm like, golly, God, I'm only one man. So more to come as well. I will say this, Seton made it very clear when I was interviewing that they are committed to Bastrop County. And that includes Smithville. So for those of you that live within Smithville, Right now, it's licensed for 8 beds. As the population grows in Smithville, we'd look at increasing those licensed beds so we can keep more people within their community. I think it's funny, and I'm kind of the same way, that a lot of the residents I've talked to in Bastrop that have a complaint against the ER, it's not because of how we treated it. It was mostly because they had to go in the hospital. I went, okay, I can totally understand that. So that's what we're trying to do, is be able to keep more within the walls. We are working on recruiting a general surgeon to Bastrop. So some of the simpler general surgeries, we could see you here in Bastrop, and until we get our OR, be able to perform the surgery in Smithville. So I think that's probably our biggest need now, is the general surgeon to come in and do the simple surgery. So if you don't mind, let's talk about COVID. I think a lot of this, you would have started to see a lot of traction on all these plans last year. However, COVID hit. That really shook everybody up, as it should. You know, the biggest focus for a hospital during COVID was, one, how do I protect my employees? And number two, how do we take care of our patients? And that can keep you up way late at night wondering if you're doing the right thing. COVID it's no mystery. The new Delta variant it's here in Travis County, or it is in Travis County, not here in Travis County. Most of those who are hospitalized and have the variant, they are unvaccinated. So I'm not going to tell you being vaccinated is your choice. It's a very personal one, but I do think that's an important nugget for everybody to know, that 99.2% of those hospitalized have been unvaccinated. COVID brought about 2 good things, in my opinion. The first is telemedicine is seen as an actual service line. So in some of the rural communities, if a specialist can't get out there, we can have a telemedicine card. And that will pave the way for us to have a telepsychiatric program in our ER, both in Bastrop and in Smithville. The emergency room is not the appropriate place for somebody having a bipolar or schizophrenic attack. And most ER physicians kind of know the basics of psychiatric medicine, but they don't know enough. And there's a shortage of psychiatric beds within the state, not just Austin, but within the state completely. So we end up holding those patients sometimes 78 hours, and we're not the right place. And so having a psychiatrist available by telemedicine will allow us to give them the right medications, maybe start some of the what we call crisis prevention techniques. The psychiatrist can do some more intense forms of counseling, all while we try to get them to a more appropriate place of care. The second thing that I thought COVID did in a positive way was it shined light on a lot of clinical staff that don't get a lot of attention a lot of times. We all know nurses are important, physicians are important, but a respiratory therapists are vital to what we do in the hospital. And they're the ones that are most at risk for COVID, because they're helping people with their breathing treatment, and the patients are aerosolizing all the COVID virus. So there were some good things to come out of it. Now, the other thing COVID did was it taught hospitals it's not a build it and you will come proposition anymore, right? The days of just putting up a 300-bed hospital with all the services and waiting for people to come, it's not there anymore. Just for instance, in Brownwood, I averaged about 75 to 80 ER visits a day pre-COVID. During COVID, that dropped down to about 20. That was a busy day. The problem was those 20, probably 90% were admitted to the floor, whereas before, probably 9% were admitted out of the ER to the inpatient. So that's good news, because you have people finding the appropriate place of care, right? The ER is too often sometimes used as a primary care clinic, refills. People have wanted to do sports physicals. I thought that was interesting. So when people come to the ER now are truly, in my opinion, ER type visits. Now, The other thing that COVID did was people were so scared of getting COVID, they weren't going to their physician. And so those that have, heart problems, COPD, CHF, they're so worried about catching COVID, they stayed at home. And then they just stayed at home and got sicker and sicker. And then they ended up coming to the ER and being admitted. And it was a way longer visit. So right now, within the Seton market, most of our hospitals are at capacity, and that's without COVID. So we've had a lot of sick people not receiving care timely. And so what do? They come to the ER, and then we end up having to admit them. So the new Delta variant has us concerned about bed capacity. Number two, the biggest concern is staff. I don't know where the nurses are going. I used to think when I was in Brownwood that all my nurses that left Ralston were somewhere at Seton. And so when I took the job, I thought, well, this is where all the nurses are, right? And they said, no, we're having the same issues. And most of it is a lot of them have the ability to take what we call travel assignments, and they can make a lot of money short amount of time, which I don't argue with that at all. Everybody's got to do what's best for them. The problem is they go and they're assigned to the COVID unit, right? You're not going to put, if you can put somebody else in the COVID unit, protect your own employees, that's what they'll do. But we've seen a massive kind of out migration of nurses who have worked for us for a very long time going to take travel assignments. So the good news is in the month of June, we recruited and signed 100 nurses. 54 of those are what we call internal, so they're from within the Austin area, and the other 50 are from outside the area. One of our biggest issues when recruiting nurses, and this is good for Bastrop and Smithville, the cost of living in Austin. It's hard for them to live within Austin proper, or even Round Rock or Georgetown, because of the property taxes that they end up taking a job. It's, I think, cheaper right now for someone to live in Dallas or San Antonio compared to Austin. So what we're trying to sell them on is come to Bastrop. The inventory is a little low right now, but it's going to be better. And then that way from here, you can hit the toll road and get anywhere you need to. You can get to our Hayes facility, Williamson up in Georgetown, or Seton, Maine, all within 30, 45 minutes of getting a palm tree. So that's our biggest challenge right now is nurse recruitment. So we're planning to work with Bastrop, Smithville ISD, anybody that has like a student clinician program. If they think they want to be a nurse, we're going to try to find a way to let them come in and rotate through the hospital. As of now, our visitor policy is the same as it's always been pre-COVID. We haven't changed that, so we're not limiting visitors. We do ask that you don't huddle around 8 or 9 people together. You are required to wear a mask, but during COVID, we were only letting one visitor at a time come up, if that. So that's been released a little bit. Now, I say that if the new Delta variant keeps coming up, we could go back to the way it was before. So we're keeping our head on the swivel as of now. You are still needing to be screened before coming into the hospital. But other than that, wear your mask, come in and check on your friends and your loved ones. So, anyway, that's all that I have. Any questions? Uh-oh, I didn't really mean to be
I'm really wondering, I know Austin's page 4 now, I think Bastrop is. When are you going to join the VA, Methodist, and the entire state of California and require all of your healthcare workers vaccinated?
Well, at this point, it's not, it hasn't been cleared by the FDA. So we've been in some HR law issue or something that's still under emergency case law.
So I didn't stop using that.
Yeah, and they had a big lawsuit.
I got lawsuit dismissed, the lawsuit dismissed, and I saw on TV on the news that 98% of the people of the medical staff that were doing such a fit, they got in line, got the vaccination, they're good. So I mean, you're asking us to go to the hospital where your own medical staff, you might catch the COVID from your own medical staff. I think that's insane.
Well, yes.
I know it.
Yes. I'm not screened, but I also know that being vaccinated is personal choice. Right? I mean, there's some people who can't take the
Personal choice can affect others.
Yeah.
Now, look, I mean, it's crazy for a medical damn disease. I mean, suck it up and go well. But I'll get another job.
Oh, yeah. Ever since COVID, 97 to 98% of my employees caught COVID, all caught it within the public, within the community, not while working at the hospital. Well, I mean, I'm not saying we couldn't catch it in the community or didn't bring it to the hospital, but I think with all of our precautions, you know, with the masking and the gloving, and we're not using the PPE over again. I think the risk is slightly less than being out. But I agree with you. My personal, opinion, not as an employee. Yeah, why would you not get back? But on the other hand, you start personal freedom and laws and all that.
There's no laws. It's just, I know you got nursing shortages, and you're worried that it would affect that. But that, the experience of these Memphis belies that concern. And I think you ought to, I know you're not the decision maker, but you are a regional manager. You ought to tell somebody.
I would say market leadership is aware of your opinion, because they are. Being shared by a lot of our board members. How about that?
Well,
If it were still run by the Daughters of Charity, then.
well, you do have a problem. You could make that decision.
No, not really.
So, anyway, I know, I work for, Indiana.
Oh, wow.
And, they're not gonna do it. They have to come out until they do a formal approval.
No.
But they've got to deal, they're part of the, they have to do politicians.
Oh,
And that's why they're not. Down.
I think
For private hospitals, different.
well, but I think the issue is if you do mandating, you know, and something happens, I mean, there are people that have had some negative consequences, right?
What? It doesn't die.
I have another question, and that's about the healthcare worker fatigue.
Yeah.
That has developed over the last year. I'm sure you've seen a lot of that.
Burnout, yeah, absolutely.
Burnout, they talk about a lot about that. Well, even something called empathy exhaustion.
Yeah. We're at a flux in the workforce. A couple of years ago, I asked my mom, who was family nurse, where are you? Where'd all you guys go? And she was quite honest. She goes, when I finished nursing school in 72, I knew I was going to spend 2 years on a medical surgical floor at night. Write it down. I had no choice. There were no options. I proved it on a med surg floor for 2 years. You could go anywhere you want. Because nowadays, you get out of nursing school, you can go work at an ambulatory surgery center, you can do home health, you can do inpatient, you can do standalone ER, I mean, there's a plethora of options. And some of it, I get, if you could make this much working 8 hours, 5 days a week, you could do a 12-hour shift at night, especially if you have a family. And so what that leaves is those who've been working for a long time and couldn't imagine it, places the burden on them. So I think a lot of things we do, we have what we call nursing working manager. So just because you're the head of a department, fill in 1 or 2 shifts if you can, give a break to somebody. And, also some of the other things we're doing as far as HR related, we've got some training for leaders on how to recognize burnout, how to help handle the burnout yourself, but also how to get that employee connected with the right people during that burnout phase. I'm not a psychologist, but if you can recognize and at least have that conversation, show concern and get them to the right person to talk to. So, and that line's available 24/7. I'm sure in Anderson has some. Oh, yeah. Oh, yeah. So we're trying. Yes, sir.
Is there a best facility to go to about ordinance?
Well, I'll tell you this. My first water lock fight I saw here in Bastrop. Plenty of rattlesnakes out there. Now, the standard treatment for snake bite is Profab. Every ER has it available. What it really comes down to is how soon go to the nearest one, and they can do the Profab injection. So we take a drill on the way. I don't know that, I'm not a doctor.
So he,
Just-
so we had, funny story, so I had a close friend who just 5 days ago, his daughter was getting a copy of the backyard. And they went to the hospital, I don't know which hospital, but they went to the hospital here. He said they weren't going to give him anything or anything, they just wanted to watch it. So they loaded him up and took him to Dell.
Oh, really?
And Dell said, oh, actually, put him on ambulance. So watching one, like, well, why that give that's pretty big.
Well, sometimes they, a dry line, not that I've ever seen one. That's a pretty big one. Well, if she didn't know now, probably. I don't know.
I saw it was interesting. Yeah, went to the state last month.
I do know.
Thank you.
I thought when the court a few minutes ago.
And napkins.
Mustache.
Oh, that's it. No. Oh.
I had clarification. The facility here in Bastrop is not doing animal surgery, so we don't have surgery.
We don't have an OR. We can do it in the parking lot.
Okay, I thought that was the reason they were so dead.
He has.
We don't have any operator capabilities right now.
Well, ARC's just not in their office. Specialty folks, I'm assuming.
We do that. I mean, I don't think ARC is opening anything to do with surgeries. Okay. At least in my conversation with them.
I thought they were just gonna have her.
You were talking about, telemedicine or psychiatric. What's the relationship with Blue Bonnet Trails?
We still have
And
that,
with,
yeah.
I know that they're here, and
Yeah.
how's that, how do you see that, continuing?
It'll still continue. So we had a good conversation today with Bonnet Trails and our telepsych director, Dr. Eaton. And all the telepsych does is just add an extra layer to what Blue Bonnet Trails already. So the way it works, somebody's coming in through a mental health crisis. Blue Bonnet Trails comes out, does this, helps us get a place. But if that placement is going to be a very long time, then we can bring the telepsych card into their room and start that process, hopefully start administering the appropriate medication, so they'll calm them down until we get to the right place. Oh, yeah, we'll still work.
Okay.
Oh.
Blow your sleeves up.
This is at the auto parts store.
Uh-oh.
I walked in
You got snake.
and there were two guys, two rough, good old boys. You know, one had a Harley Davidson. Fell, had to look twice. And he had a mask.
Yes, sir.
Now, boy, and then the guy next to him, good old boy, he had his mask on. Now, people didn't have it on. I didn't have mine on. I've been vaccinated. But I do know family members who do not want to get vaccinated. And I thought, well, certainly it's not because that good old motorcycle riders are scared of a little injection. But so what's happened to me, it dawned on me. So they're conscientious enough. They're not going to get the vaccine, but they're going to keep wearing their mask.
Yep.
And is that the appropriate behavior? If you have this unbelievable aversion to getting the shot, you just keep wearing your mask, right?
That is what I've been told.
Okay. That's the first time I saw it, and I said, I hadn't even thought of that.
Yeah, and so, but it's also hand washing. A lot of people forget about the hand washing, because that's one of the quickest way to spread. I mean, even during flu season or cough and cold season, what does your doctor tell you?
The other crazy thing is, just the idea that someone is just going to deliberately not get the vaccine and just go blatantly not wear a mask because of something they heard or their position in the work, their life.
I've been told that I need to put a magnet over my arm because that's how the government put the tracker in through the vaccine.
Oh, yeah.
Yeah. I know.
Just an observation.
And your fertility will be
Yeah.
very diminished. That's the least.
You know,
She's told some people in her family.
oh,
No, I
well,
mean,
This is the real thing.
I mean, when it comes to the vaccine, as with any new drug, there's I mean, if you watch the TV commercials for even reflux medicine, let's discount all the biological stuff that you use for psoriatic arthritis or some of the rheumatoid. They all come with warnings. I mean, one of the most frequent antibiotics used is Levin. And people gobble it up, but yet if you look at the black box warning, right? Key black box warning. If you do any strenuous activity, you can rip your tendon. Now, I know that because my wife absconded at the black box warning, decided to jump on the trampoline with her daughters and relive her high school cheerleading days. But that's the thing. People who are questioning the vaccine, I'm fine if you question it, but apply that line of questioning to all medications you take.
Well, I'm actually worried about that we will spill over with other vaccines. People now will anti-vaccine, will take the measles vaccine, the other vaccines, won't vaccinate kids.
Yeah, and that's
I think that's a concern.
it is a concern. My wife is actually, she's a PA, she's a physician assistant, and she does pediatrics. And was it, 5 or 6 years ago, there was that whole Facebook thing about vaccines and autism. And her pediatrician that she worked under just put a sign on his door said, if you don't want your kids vaccinated, request your record to be sent somewhere else. And now it's turned out to be, that guy falsified the data, in order to get that.
Wait.
Yeah. That's a lesson to all young budding researchers. The data is the data, don't let it. So it's a loaded gun. I mean, I've had nurses kind of get upset because for a while when COVID first hit, if you were treating COVID patients, we were giving you a shift differential. We were paying you a little extra, right? And then you had some nurses that weren't doing it. In fact, said, we're not going to see COVID patients, okay. But then they said, well, shouldn't I get that pay differential? And my first question is, do you go home to your bunker? She said, no. Why? I said, I saw you at Walmart on Saturday, no mask, walking around. And I said, so how do I know you're not going to catch COVID at Walmart compared to the hospital? You have no way of proving to me that you didn't catch it through the community, But that was back in the early days. I think most in healthcare are confident now. I mean, I look back when COVID first started, you had to put patients in negative pressure. It was vent right away. It was start this, and then over time it slowed down. I had a nursing home at Brownwood, all 33 residents and staff caught COVID. The state called me up and said, well, we're going to shut them down and move to your hospital and time out because I only have so many vents, and I can't. But when COVID was really bad, I was getting calls from Sweeney, Texas, all the way up to Brownwood to send a patient. I will say this though, a buddy of mine, pretty high up at one of the big Houston hospitals, and they were on the news with their ICU being full of COVID. I said, man, are you really cool? He said, Jones, I do heart transplant, lung transplants, liver transplants. My ICU is at 80% capacity regardless of COVID. COVID just makes it extra tough. I just don't have the bed. I just don't have the open beds anymore. And I said, are y'all still doing heart transplant? Well, yeah. I think somebody would rather risk COVID than, die because of heart failure. So I think the more we learn, listen, I'm not a fake news type of guy, but I don't think the media has helped anybody. I don't think social media has been helpful. But there's just a lot of rumors running around, one about COVID and two, the vaccine itself, like, the magnet, you gotta wave it over your arm and all that. So I just think that before you make a decision, you should read all the data from a very midline standpoint instead of what Facebook told you or what your friend said happened to a friend of a brother-in-law who's married to an ex-sister that lives in Canada. I'm more upset about COVID because it canceled my elk. I mean, if anything, forget the stress of running the hospital during it. That was, my wife was happy, but she was off. So anyway, any other questions? No?
Well, that's
That's enough?
well, basically, this is incredibly informative. By the way, Jason, let's see, Sprinkle Lake.
Can't you kick it?
It's the thought. But anyhow, Jason actually, besides being very informative, he actually had the audacity to send his application for membership.
I'm a. That's just.
So,
That's.
I think Jason's an example of a fantastic Rotarian. So anyhow, this is the.
Nobody said yeah.
I already approved his membership.
Well, okay.
What we're trying to do is get, yes. Go
You
ahead.
know those applications supposed to go through the board.
I know.
They go to the-
So, and we'll pass that along, but just, there's a process. And so we're set to the plan. But just so you know. Let's see here, with that, we'd like to welcome some of our new visitors, like our Smithvillian fan. I'm a huge fan of Smithville, by the way. Well, property out there.
Well, I bet you are too. I bet you are too. I'm a fan of Smith.
It's a good one, just
I
like.
graduated from Smith High.
Really?
I'm a real.
We're making a 105 acre wildlife preserve out in Smithville. Another story. One of our prizes for the Lost Pens Barbecue Showdown, this thing will be a wildlife event. Another long story. With that, let's move on to the forward test.
Everybody's ready?
Anyone like to?
Any other questions?
Any other business? Yes, Larry, do you have any words of wisdom? Okay, let's do the forward.
How are those, Moses?
Oh, man, they are wonderful. I knew what to get.
Okay.
Okay, let's move on to the forward test.
Certainly. Please join me in the four-way test of the things we think, say, or do. First.
Is it the truth?
Second.
Is it the
Third.
Will build goodwill and better friendships.
Fourth. Will build
Beneficial to all concerned.
Very good. Thank you.
Thank you.
We don't let that happen.
Well, there's a smart team on the